Right, so today we're going to talk about the MRCGP Simulated Consultation Assessment, the SCA. So this is the new exam that's going to replace the MRCGP CSA and the MRCGP RCA, and it's starting from November 2023. It's going to be available 9 times a year. There won't be a December sitting, there won't be one in July, there won't be one in August, but otherwise every month there will be an option to sit the SCA. So it's going to be done entirely remotely, and you'll do it, in most cases you'll do it at your own practice. There may be a few practices that don't have the right tech set up, in which case you might go to a different local practice within your scheme, within your deanery, local to you, okay? It's going to consist of 12 cases, each lasting 12 minutes, and there'll be 3 minutes reading time to read the notes for the patient that's about to be seen beforehand. And in that it will tell you, is it going to be a telephone consult or will it be a remote video? So there'll be no face-to-face, no one in the room with you. And the whole thing is done remotely. In terms of what type of cases, the proportion of cases will be slightly different each day in terms of how many are video, how many are telephone. But the examiners have said roughly of the 12, 9 will be video, remote video, and 3 will be remote telephone. Sometimes there might be 8 remote video and 4 telephone, slight variation, but roughly that proportion. Okay. In terms of the actual cases will be different each day, but there will be the same case palette, i.e. the 12 cases, there'll be 1 each drawn from these 12 case types that are shown on the screen. Okay. Now within that, of course, what will be the actual case, and then there's going to be some things that overlap. All right. For example, you might have a child health case that's to do with someone with a mental health illness. You might have a teenager coming for contraception, since that overlaps more than one domain. You've got the sexual health, men's and women's health, you've got younger people. Okay, so there can be things that overlap, but every single day there will be 1 case from each of the 12 areas as the main context of that case. Okay, now the whole thing is done with simulated patients, so no real patients. These are all trained professional simulators, so that they're calibrated and they will consistently play the role, give the same cues, answer the questions in the same way, but with a leeway that depending on what you ask and whether you pick up and explore certain cues, that they've got variations that they can implement. The whole thing will be recorded and then marked later. So the marking is asynchronous. It's not being marked live. It'll be marked later, and each case will be marked by a different examiner. So each person will have 12 different examiners marking the 12 different cases. Okay. For each case, there's 3 domains that you're going to be assessed on. So the first domain is data gathering and diagnosis, i.e. can you take a concise, focused, safe history, get the right information, explore the relevant risks, symptoms, but also exclude relevant red flags. There will be no physical examination for any cases because the patient's remote to you. Okay. That's going to be now examined in the workplace-based assessment. So there'll be some changes made to that going forward. But you've also got to, do you get the right diagnosis or at least narrow it down to a sensible differential? That's the first domain. The next domain is management and managing complexity. So, do you manage the main problem, think about other secondary risks, other important things that are mentioned there, but also can you deal with complexity? And then finally, relating to others. So this is about interpersonal skills, about how you approach, the other person. Do you take on board their perspectives? Do you pick up on and explore cues? Do you explain things in a way that shows empathy, sensitivity, clear communication? All of that is part of relating to others. And in terms of the cases, the majority of them will be simulated patients, but you may have some cases where it's not a patient that's being simulated, but it might be a relative or a carer of one of your patients, or it might be a professional discussion with a colleague, district nurse, practice manager, someone else in the healthcare team that you have a discussion with. Okay, so there's lots of things that are similar, if you like, to the old CSA and RCA. So in terms of RCA, the fact that it's remote. In terms of CSA, that is standardized with simulators, but also some differences. The number of cases, the time is 12 minutes per case, but 3 minutes to read before each one. And then the fact that it's being marked by 1 examiner. RCA was marked by 2, CSA was marked by 1, but it was marked live. This is being marked later on and recorded. Okay, it's been marked asynchronously. So, if you'd like to find out more about this and start preparing and practicing for SCA, you'll find our MRCGP SCA Masterclass, which is a half day. Includes detailed breakdown of the 12 case types and what cases you might get within each one. We'll look at how to structure your consultation. We'll look at the care consultation model. We'll look at key communication and interpersonal skills. But we'll also have some interactive cases. You'll be able to practice and get involved and see what kind of cases might come up and what does it feel like, how much can be got through in 12 minutes, okay? And then our full day intensive SCA course, small groups with practice and detailed individual feedback, okay? That's going to launch later on at the end of August, okay? So watch out, I'll post details in the group, but MRCGP SCA, key things, 12 cases, 12 minutes each, 3 minutes reading before each one. You'll do 6 cases, then have a break, then you do the other 6 cases. And the proportion, most cases will be remote video, a smaller proportion will be remote telephone, 3 domains marked in each case, okay? So if you found this helpful, do like and subscribe to this video, do share it with your colleagues, okay? Remember, like any examination, prepare and you will succeed.